Hi, my name is Kendra Pierce. Today I'm covering chapters 9 through 14. Chapter 9, I have chosen prostate gland. It's part of the male reproductive system. It surrounds the urethra. 2. The polycystic kidney disease is a genetic disorder characterized by the growth of numerous fluid-filled cysts in the kidneys. 2. Urinary incontinence is the inability to control urination. Hemodialysis is the process by which waste products are filtered directly from the patient's blood. This takes place through an artificial kidney. Chapter 10, receptors, are sites in the sensory organs, the ears, eyes, nose, skin, and taste buds that receive external stimulation. The receptor sends stimuli through the sensory neurons to the brain for interpretation. Afferent neurons, also known as sensory neurons, emerge from sensory organs and the skin to carry impulses from the sensory organs towards the brain and spinal cord. Efferent neurons, also known as the motor neurons, carries impulses away from the brain and spinal cord toward the muscles and glands. Serotonin, which is released in the brain, has a role in sleep, hunger, pleasure. It also sometimes is linked to mood disorders. The medulla oblongata, which is located at the lower part of the brain stem, is connected to the spinal cord. It also controls basic survival functions, including muscle, respiration, heart rate, and blood pressure. And it also plays a role in coughing, sneezing, swallowing, and vomiting. Chapter 11, the cornea, is the transparent outer surface of the eye covering the iris and the pupil. Ophthalmologist is a physician who specializes in diagnosing and treating all spectrums of disease and disorders of the eye. Cataract is the loss of transparency of the lens that causes a progressive loss of visual clarity. The formation of most cataracts is associated with age. Chapter 12. Exfoliative dermatitis, a condition in which there is a widespread of scaling of the skin and hair loss. In severe cases, you can see on the skin eczema, psoriasis, and you can see allergic reactions. Chapter 13, hyperglycemia, is characterized by abnormal high concentrations of calcium circulating in the blood. Chapter 14, bacteria vaginosis, is a condition in women in which there is an abnormal overgrowth of certain bacteria in the vagina. This condition can cause complications during pregnancy and increase the risk of HIV infection if exposed to the virus. Symptoms sometimes include discharge, odor, pain, itching, and burning. Thank you.
Hi, my name is India Williams, and the 15 terms I have chosen, starting with the first one, is nephrosclerosis, which is an abnormal hardening of the kidney. Incontinence, being unable to control excretory functions such as excretory functions. Urinary catheterization, the process of withdrawing urine from the bladder. Cerebellum, it coordinates muscular activity. An anesthesiologist, a physician who specializes in administering anesthetic agents. A coma. A profound state of unconsciousness marked by the absence of eye movements, lack of speech in response to painful stimuli. Incus. The auditory ossicle, which is also known as anvil. Oval window. Separates the middle ear from the inner ear. And otis media, an inflammation of the middle ear. Cellulitis, acute, rapidly spreading bacterial infection within the connective tissues, not confused with cellulite. A second-degree burn, a burn having blisters plus damage only to the epidermis and dermis layers. Keratin, fibrous protein found in hair, nails, and skin. Polyuria, excessive urination. Hyperglycemia, an abnormally high concentration of glucose in the blood. And pancreatitis, inflammation of the pancreas. Thank you.